Problem in feet are warning signs and symptoms: loss of sweating and dryness of skin, hard, thickened skin with cracks and scars, loss of sensation of touch, pressure, pain or temperature, redness, blister, wound, burn, non-healing ulcer, weakness or paralysis of muscles of foot, unable to stand, on heels or on toes, thinning and wasting of muscles, stiffness and contracture in joints of toes or ankle, swelling of foot or toes, unable to lift the foot at ankle joint. Loss of toes, shortening of toes, unable to walk without dragging foot, daily inspection of feet. The reason for your disability or deformity may be repeated injury and development of wounds. Injury may lead to wounds and ulcers if care is not taken, pressure, rubbing, getting burnt by fire or hot objects, puncture of skin by sharp pointed objects leads to redness, blister and wound. When wounds heal, scars are formed. Skin becomes hard due to scar. Scars can crack to form wounds. Care of feet. While standing, walking and setting, feet have to be protected. Both indoors and outdoors, always wear shoes or chappal, except during sleeping. Do not stand for too long, sit on a chair. Do not sit or squat on the floor to protect the ankles from pressure and rubbing on the floor surface. While sitting on the floor, keep legs straight in front of you. While walking, take small steps and avoid hurting the feet. Do not cover long distance in one go. Take frequent halts to give rest to feet. Travel by bus or scooter car extra. Give rest to foot with wounds. Walk carefully, avoiding stepping on pebbles, thorns, bushes to prevent injury to foot. Do not walk bare feet on rough and hard surfaces. Frequently check feet and sole of feet while walking for any redness, blister extra. Buckles causing pressure on foot. Footwear with Velcro strips should be preferred. Use chappal with a belt to keep it from falling off from the feet. If any part of the foot looks red or feels warm, or there is pain or you see blisters, you have caused injury to foot. Stop walking, sit on a chair and give your feet rest. If you have injured the foot due to touch of hot object or contact with fire, stay away from such things and avoid them in future. Use microcellular rubber shoes and chappal which have a hard outer sole and soft inner sole. Care of the skin of foot. Soak the feet in water of room temperature for 20 to 30 minutes. When feet are soaked and dead layer of hard skin has become softened by soaking, remove the dead layer of skin using a piece of stone brush or rough cloth. Remove the dead, hard skin layer very gently day after day. Take care not to remove too much of the dead skin layer so as to not expose blood capillaries and raw skin. Do not wipe the feet dry. Apply oil or Vaseline to wet feet and massage the foot and toes. Massage the toes in a direction to straighten the toes and to keep the joints mobile and to prevent development of stiffness and contractures. Exercise for weakness, paralysis in foot. With weakness or paralysis in muscles of feet and toes, skin over the joints becomes hardened and tightened. 2. Keep the feet and toes mobile and prevent development of stiffness and contractures. Regular exercise is required. As shown in the picture, use a long piece of cloth for exercise of the foot. Sit down with legs stretched out in front of you. Keeping a long piece of cloth around the foot, hold the ends of the cloth in the hands and pull the foot towards the body. Hold this stretch at the ankle joint to a count of 1 to 10. Repeat this 20 times. Repeat the exercise. This exercise is advised for persons suffering from foot drop. Do exercises of foot as shown in the picture. These exercises can be done actively on your own or passively by taking the help of few hands to perform the movements. Passive exercises improve mobility and prevent stiffness and contractures. Active exercises help in improving the strength of muscles. Every movement has to be repeated at least 20 times. The exercise must be repeated at least 2 to 3 times in a day. Stretching exercise for foot. Stretch the ankle keeping foot flat on the ground and moving the body forward. Repeat 20 times. Exercise 2 to 3 times daily. Aids and appliances. For special aids and appliances, contact the nearest government hospital or the office of district leprosy officer.